we're going to talk about Joe Burrow, and we're going to talk about the turf toe.
It's weird. You think, how do you miss so much time with a turf toe?
Well, we'll find out because Dr. Elena Wellens is amazing. She's diplomat of the American Board of Foot and Ankle Surgery and a fellow at American College of Foot and Ankle Surgeons. She's one of our great Rothman doctors. Good morning, Dr. Wellens.
Hello. Thanks for having me.
Good to see you. You look, now if you came in, automatically you go, what a great disposition.
I agree.
You have a wonderful smile.
Yes.
All right? Like, automatically I feel at ease.
Well, I appreciate that. Thanks.
Great smile.
Yeah. So let's talk about the turf toe. Because we hear turf toe and you go, all right.
Stub my toe.
Right. This is a serious deal. Joe Burrow's going to miss 3 months. Explain it for us.
All right. So I'm not treating Joe Burrows.
Right.
However, I can certainly speak on the turf toe injury because it's one I've seen, fair share of times over the years. It's a nasty injury. And when you think about your big toe joint, people take it for granted. When you're running or jumping, like these athletes are doing, it takes upwards of 800% of your body weight through that joint. And it's actually a very complex joint. When people think of turf toe, it's not the big toe, it's the actual first metatarsal phalangeal joint. So essentially what's happening is within that joint, you have your metatarsal and your proximal phalanx. They're the main bones forming the joint. And then on the bottom portion, you have your plantar plate, your capsule, multiple ligaments, your flexor tendons, and your sesamoid bones. These are a lot of parts that have to work together to allow athletes to have those quick pivots, that quick propulsion. So that's why a turf toe injury is so serious if there's an injury to this area.
Where is it? So it's at the base of the big toe?
Yeah, so you have your big toe and the big toe joint. I don't have the foot in front of me. I'm trying to get on the camera here, but essentially where your big toe bends up and down, that's your first metatarsal phalangeal joint. And that injury, the turf toe, is damaging the structures on the bottom of that joint.
Wow. Well, now, that's funny, don't laugh, but this week it cropped up. I was running and I feel it at the top of my toe. Now I'm wondering because it's at the base of it and it's the top and it's killing me.
You got the gout?
No, that's ankle swelling.
No, it's the big toe.
So, I mean, without seeing you, there's a possibility you have flat feet. So you're getting jamming at it when you run.
Yeah. I got the extra large big toe too. I have the extra large big toe. It's an abnormally big toe. It's a long big toe.
Well, with the turf toe injury, it's a bit different because it's what we call a hyperextension injury.
Right.
So imagine you're an NFL quarterback. You're getting ready to throw the ball. So you're right-handed. Your arm's all the way back behind you. Your left foot's planted in front of you. As you're going to throw the ball, boom, you get sacked from behind.
Right.
What's going to happen is that left big toe, it's planted on the ground. All of a sudden, it's going to get hyper extended at the front, and that big toe is going to jam up. And that's where the injury happens. That's where you get the turf toe. And there are different degrees of turf toe injuries, and it is a common injury in sports, whether it's football or soccer or basketball. It can happen in any sport. Now, there are 3 grades of injury. So grade 1, the most common, is just a straight up sprain. There are no tears. It'll take a few weeks to settle down with rest and immobilization, and then you can get back to activity. Grade 2 injury, now we're dealing with some partial tears of those soft tissue structures. At that point, it's going to be a longer rehabilitation period with a more extended immobilization and then gradual therapy to get back to full strength. Grade 3, that's the serious injury. That's where we require surgery.
Wow.
And in this case, you're having complete rupture of soft tissue structures. You have potential dislocation of the joint, potential cartilage damage, and also potential fracture to the sesamoid bones, which are two little round bones at the bottom of the joint that look like little cherry pits. They're critical because what happens with them is the flexor hallucis brevis tendon on the bottom encases those sesamoids, and then the flexor longus runs in between them. That's how we get our power. That's how we get our propulsion to sprint, to run.
Right.
So if you have any type of injury to those sesamoid bones and the surrounding structures, that is a serious injury. And in a grade 3, yeah, you have to fix it surgically. And it can be a very long recovery.
So there's hope that he comes back. Now, obviously, you don't treat him, so you don't know the severity of it. But we know it's of the worst kind. So it's a tough.
Yes.
I mean, that's tough to come back from.
It is a long recovery. Once you get through the acute phase of healing after surgical repair of whatever structures were damaged, then there's the rehabilitation period. Getting back into the game is going to require a player to be able to do the propulsion, to run and toe off without pain, and to have full strength. Now there is hope. One of my colleagues, Dr. Perek, did a retrospective study a few years ago, and he looked at data on NFL players, particularly offensive players, and he used the power rating as the score to determine if they're improving. When he looked at all the data, he saw that there was really no change in the power rating pre-injury to post-injury. So what is encouraging about that is it tells us that, hey, yeah, most of these players can come back to their previous pre-injury level of play. And I think that's great news. Does it happen for every player? No, but it appears that the majority, yes, it does.
Wow, that's fantastic. Doc, you know your stuff. I mean, all of our Rothman doctors are amazing, but just listen to you how you break it down. You obviously are a sports fan. You obviously understand it. You understand movement. Your way you break it down is amazing. It's every time we have our Rothman doctors on, I always feel comfort, right? Because I go, God forbid if something happens, I know I got Rothman to help me stay in motion. I mean, I'm serious. It's amazing.
I appreciate that.
Thank you so much. You explain it to us idiots, right? Like they're just
not idiots.
Lunkheads. So I really, Doc, really appreciate it. You're fantastic. Who's going to win the Sunday, Eagles Rams?
Oh, Eagles, go Birds.
I love it. I love you. You are awesome. I knew it. I heard your accent. I'm like, well, she's an Eagles fan for sure.
I'm a Jersey girl. Yeah.
Where'd you grow up at? Where at?
I grew up in Mount Laurel. Now I live in Marlton.
Oh, nice. Oh, that's fantastic.
Didn't make it far from home.
In fact, we were just there. My son plays for St. Augustine. We just played Cherokee. So, yeah, we just played. He plays football for them.
Awesome.
Yeah, so we were just there. Anyway.
Yeah, I'm a Bishop Eustace grad, so.
I love it. I love it. Oh, that's fantastic. You're awesome, Doc. Well, you got to get you again,
Thanks
okay?
so much.
Promise you'll come back.
Absolutely. I'd love to.
Thanks, Doc. Appreciate it.
All right.
She's
Take
amazing.
care. Have a good one.
You too. Oh, man, she's awesome. Dr. Elena Wellens.